Doctor, there's a photo going around claiming it's Trump's before and after plastic surgery. I'm so curious whether he really had surgery, maybe a facelift or something with his nose.
Looking at the photo now, I also wonder if he really did get something done. I'm Dr. Kim Kukyan, specialist at Human Plastic Surgery Clinic. Since he hasn't said himself whether he had surgery or not, we can't say for sure, but judging by the photos, it seems like they're heavily edited. But the skin looks tighter, wrinkles are gone, and there's more volume around the nose. In that case, it either looks like he had surgery, or at the very least, that the photo was edited really well.
Then how about Trump's nose?
There are a lot of photos of Trump when he was younger. He's also been in a lot of movies, and I've seen many photos and videos of him going around. He actually has a very nice nose, tall, straight, not too thin, with good skin thickness and full nostrils. The bone isn't too wide or too narrow, and the thickness suits his facial proportions. The tip of the nose is a bit long, so it's less exposed, which can make him look a bit older.
But Trump had a good-looking nose when he was young, right?
Yes, that's true.
Does your nose get ugly as you age?
It's not that the nose gets ugly, but the surrounding areas start to age. The face around the nose changes, and the skin on the nose loses elasticity. And since we spend a lot of time standing, gravity naturally pulls down the nasal bone and cartilage over time. Compared to older photos, the tip of the nose seems to have dropped a bit. So from the side, you can see a bit of a bulge or a curve forming. But this is just the nose aging naturally along with the rest of the face, not an awkward or unnatural change. Is there a nose design you would recommend for Trump? Judging just by President Trump's nose, it doesn't seem bad at all. But everyone has desires, they want to look better and improve little by little. Looking at the shape of Trump's nose, the starting point from the forehead is actually quite good. However, when the tip droops, it can give off a slightly angry or aged expression. If we could slightly lift the drooping tip to create a younger-looking nose, just that alone would be enough to achieve a satisfying result.
Are there any particular features of nose surgery among Americans?
Unlike Koreans, Americans often have noses that are too large. Compared to their overall face, they often have large, crooked, or humped noses. So nose reduction procedures make up a larger portion of their surgeries. Therefore, when the cartilage is trimmed and the nose shape improved, the goal is usually to make the large nose more balanced with the face. Secondly, their skin tends to be thinner than Koreans, because they also have thinner fat layers. Instead of inserting implants, they often undergo nose surgery using autologous cartilage or tissue. It's said that many adults have a split at the tip of the nose. Why does this happen? There are two main reasons. One is that the inner cartilage is highly developed, so it becomes visible. The other is that the outer skin is very thin, making the cartilage underneath show through. It's similar to how many Westerners have a chin dimple, what we call a double chin. It's a similar case. Because the cartilage is well developed and the skin is thin, that developed cartilage becomes visible externally. Recently, even some Korean patients want a slightly split-looking nose tip. This usually appears when the cartilage is very strong and the skin is thin. So it's a feature somewhat different from those typically found in East Asians.
Do Westerners get stressed about that, or do they not really care?
Even if their nose tip is very split, Westerners don't seem to be that stressed about it. If your alar cartilage is well developed and visible, it doesn't necessarily look bad, so they seem fine with it.
Do many Westerners come to our clinic?
We do occasionally get Caucasian patients with thin skin. For these patients as well, rather than using silicone to raise the nose, we mostly perform surgeries to lower the nose, straighten crooked noses, or correct nasal obstructions and severe rhinitis.
Doctor, do you remember any particular Western rhinoplasty case?
There was a Caucasian woman from the UK who had undergone multiple surgeries. Unfortunately, she had also suffered a severe nose injury in a car accident, so her nasal bones were very fragile. We had already used costal cartilage and other available grafts. Since it was hard to use additional grafts, we used a different rib cartilage through the same incision line. Then, using fascia from the scalp, we were able to create a subtler and softer nose shape. The patient was very anxious due to her multiple surgeries and felt great stress about her nose shape. Thankfully, we achieved a satisfying result, which made both the patient and me happy. I was planning to analyze general nose shapes, but Trump's nose came up, which was a bit unexpected. Still, this kind of analysis is fun and refreshing. If you have any other questions, feel free to leave a comment anytime. Or if you're curious about a particular nose shape, I'd be happy to analyze and talk about it. This was Dr. Kim Kuk-hyun from Human Plastic Surgery Clinic. Thank you.